I would stick with everything that I've said there in terms of preventing COVID-19 to be exactly the same as if you were treating COVID-19. And real brief. So if you've been supplementing with vitamin D all along and you come down with COVID, continue to supplement with vitamin D. But if you're watching this video and you have not been supplementing with vitamin D, you probably should start. And there is some evidence, but you probably would want to check with your primary care or healthcare provider first. There is some evidence out of India in the SHADE study where they gave 50,000 units orally, daily, for 7 days, and then ramped it back down to a regular dose of approximately 4,000 to 5,000 units, international units. So, and as they said, it's probably the most safe fat-soluble vitamin there is. Taking vitamin K is going to be counterproductive to your therapy that you're getting with that medication, so I would not recommend that in that situation. The other element that's very helpful and beneficial if you're taking vitamin D is magnesium as well. And there are some studies that look into that as well as dosing.
If you just go to Google and just Google vitamin D and the structure of vitamin D, one of the things that you'd be struck with is it's a bunch of rings and circles for those of you who don't know chemistry. But then do the same thing for testosterone or estrogen or cortisol or aldosterone. These are essential steroids that the body needs to live. If you lose these steroid hormones, you'll die in a matter of weeks to months. And if you look at vitamin D, it's unique that to any other vitamin B, vitamin B3, B6, B12, C, none of those look like this. Vitamin D is a steroid hormone. And what that means, what we know that means, is that vitamin D binds to its receptor and goes into the nucleus of cells. And it affects how that cell transcribes its DNA, how it makes proteins. And so that's the first thing that you ought to realize, that vitamin D is not just some cofactor that binds to something and allows something to happen. It actually changes the behavior of your cells. Yeah, so vitamin D is kind of like the cry wolf, the boy that cries wolf, because for years, medicine has been looking at vitamin D and saying, oh man, it's good for rickets, but it's probably good for a whole bunch of other things. And they've done studies on it, and sometimes it comes up blank, sometimes it comes up. So it's kind of like, yeah, when a lot of scientists heard that vitamin D might be beneficial in COVID-19, they said, yeah, fool me once, shame on you, fool me twice, shame on me, type of thing. So that's why there's been a lot of resistance to saying that vitamin D is working. But if you go back, there was a study, a landmark study that was published in the British Medical Journal just a few years ago by a scientist named Martineau, who did a meta-analysis looking at vitamin D supplementation, and he found vitamin D supplementation on a regular basis, taking it either daily or weekly, decreased the incidence of acute chest infections. And this has been borne out multiple times. There's an Irish study that looked at this called TILDA, and they reported it recently as well. This is for acute chest infections, so generally viruses that affect the chest, so influenza, rhinovirus, probably coronaviruses in there too. All of this done before COVID-19. So we knew from a medical standpoint that vitamin D supplementation, especially in patients, this was done in Northern Europe, where vitamin D deficiency is quite, plentiful. So to see that worked there, now let's take it and apply it to COVID-19 to see if it also works in COVID-19. Of course, the studies take a long time to do, and we didn't have those studies early on. So that's where things started. Large observational studies where you just kind of look and see what's going on, and you'll see things that are associated with each other. It doesn't tell you that one is necessarily causing the other, you just see them showing up together. And that sort of gives you a hypothesis, like maybe these are connected. For instance, if you saw that a lot of people with lung cancer also carried cigarette lighters in their pocket, right? You couldn't say that the cigarette lighter is causing the cancer, but they're showing up together. So maybe there's either something else that they're both causing or caused by each other. So that's what we started seeing in the first part of 2020 is observational studies. What did we see? We saw that people who were showing up to the hospital with COVID-19 were deficient in vitamin D, that people who did worse in COVID-19 were deficient in vitamin D. We started seeing that people who are older, people who have darker skin, are the people that also are deficient in vitamin D, and they also have worse COVID. And so we started to see this connection, but the words that go through any graduate of medical school or any biostatistician will tell you that association does not necessarily mean causation. And so that's where we were for the most of 2020 until just the last few months, was these studies over and over again. Yes, we can predict how well they're going to do based on their vitamin D levels. Yes, if they're lower, they're probably going to have a worse course. But the part that we couldn't say based on that data was, if we give vitamin D, is that going to change something? Because maybe the disease is making the vitamin D go down and make them sick. And it's just like, if I take a cigarette lighter out of someone's pocket, is it going to make their lung cancer go away or prevent, right? So that's the kind of thing. So now enter randomized controlled trials. And this is what we do. We say, okay, we're going to start off, we're going to randomize people, we're going to blind ourselves to it, blind them to it. For one, we're going to give vitamin D, for the other, we're not. And then we're going to see what happens. Let's back up a little bit and talk about vitamin D. So people say, well, should I take vitamin D3, D2? What is vitamin D? So this is how it works. You have cholesterol in your body, and it's hanging around. And when ultraviolet B radiation comes from the sun, it comes through the epidermis, which is the top layer of your skin, and then it penetrates down into the dermis, and it comes with just enough energy to do a conformational change on one of the carbon bonds, which flips it to be kind of nerdy here, but it actually converts, the ultraviolet radiation converts the cholesterol structure into vitamin D. So there are some solutions to this, right? So fish oil is rich in vitamin D. There are certain like mushrooms that are rich in vitamin D, and of course, we live in 2021, right? We've got supplementation, so you can take that and not get the risk there. What is the maximum dose that you can take without supervision from a physician, and for someone who is at risk for vitamin D deficiency? The answer is 4,000 international units daily. And so what would I do if someone asked me? I take 5,000 international units daily just because I had my levels checked. I think the right answer is, if you can, get your levels checked.
Got it.
And where would you want to be? It's measured in nanograms per milliliter. I would say, based on the data that we've seen, the retrospective data in the United States, we see that there is an increase in SARS-CoV-2 positivity once you start going below 50 nanograms per milliliter. So if you're not above 50, you might want to bump it up at least over the winter season. And wouldn't you know it, that what are we seeing? We're seeing a rebound in SARS-CoV-2 in the winter season. So this is not rocket science. It's because we're not getting enough sunlight. The days are short. People don't have enough vitamin D, and this is what the theory is. So the other thing that I would talk about is NAC. That's one of the things that we've been talking about. NAC is N-acetylcysteine. There's some pretty good data that shows that SARS-CoV-2, when it infects your cell, it knocks out the receptor called the ACE2 receptor. This ACE2 receptor is very important in regulating oxidative stress in your body. So one of the things that may be beneficial is consuming products that are antioxidants. So, berries, strawberries, raspberries, elderberries, blackberries, all of those are excellent things to do. But if you want to increase even more, then taking 600 milligrams of NAC twice daily was shown in a previous study to reduce the symptoms of the flu virus in a winter season when it was done prospectively. So in other words, they randomized people to placebo versus 600 milligrams of NAC twice daily, and they did not see a difference in the incidence of the flu in those people, but they did notice a significant reduction in the severity. I think zinc is really important too. I would not take more than 40 milligrams of elemental zinc a day, because as you increase your zinc intake, you can reduce your copper in your body, and that's not a good thing. You want to have enough copper. So zinc and copper are kind of like on a seesaw, but if you want to maximize your zinc intake, 40 milligrams of elemental zinc. I say that because when you pick up a zinc supplement, it could be zinc picolinate, it could be zinc sulfate. All of those have a different molecular weight, And so the milligrammage is going to be different. But if the bottle is worth anything to put the pills in, it'll tell you how much elemental zinc is in there. 40 milligrams is the maximum daily dose. So there is some evidence that zinc can help stop viral replication. The protein that the virus uses inside your cells to make more of those viruses is called replicase. And there is some evidence in vitro data, albeit, that zinc shuts that down. The problem is that when you take zinc, you need to get that zinc inside the cell. And one of the things that has been looked at and has had some promise in Ebola, for instance, and was being studied in this virus is quercetin. Quercetin is a natural product. It's over the counter. It's high in concentration in capers, in onions, in vegetables, roots basically. And so I don't see a lot of downside with taking quercetin. And so I do that as well. And then the last thing, I left the last thing for the end. And that's something that you're probably like, well, what are you doing with this? And it's a long story that we can break into. But contrast showers. I do hot for 5 minutes, and then I do cold for 1 minute. And then I do 5 for hot again, and then 1 for cold, and then finish it up with 3 for hot and 1 for cold. And the one that clued me onto that formula was a Dr. Neil Nedley, who is out of Weimar, California, who's actually done a lot of research, and it actually has a clinic up there called New Start that's doing this sort of stuff, and with amazing results.
The thing I would add too is none of this is 100% protective or curative. So you still have to do all of the other things that the CDC is saying, like mask wearing, distancing, all of that. This is a way of tipping the scales in favor of you in terms of your immune system.